Welcome everyone. We will be talking on occupational disease. We love to find out the symptoms, the causes, and the probable preventions technique thereby. So yes, everything to do within occupationals, as in the ailment, the physical ailment, the mental ailment, the medical ailment that comes around it. What are the symptoms, and how do we find out the reasons behind them? Is the crux of today's presentation. So occupational disease are preventable. Many people find this is a myth, as in occupational disease, somebody is born with a certain profession, working in a certain profession for a certain period of time. Now, this certain period of time might be 10 months or 10 years. The longer the duration, it is supposedly incurable, but this is a wrong myth that I want to stress upon it. Occupational diseases are preventable. They should be prevented due to humanistic and probably economic factors. Occupational disease most frequently occurs in workers having direct exposure to agent at workplace. Rarely, relatives of those workers could be diagnosed as well. Notification of occupational disease is mandatory. Workers are paid on a compensation when an occupational disease is diagnosed as a compensation for the rest of his work life, which is pending probably. In government concern, most of the federal government would be benevolent towards the workers, but in the non-government concern, things may vary. But definitely there is a leniency when it comes to the payment is to be done. Diagnosis of an occupational disease could be a chance to prevent multiple cases, and or should I say the rest of the cases, the rest of the workers who are going to henceforth, who are susceptible to such kind of occupational disease will be prevented. So it makes sense to go for the causes of occupational disease and probably take steps to prevent it thereby. If a disease is not responding to a standard treatment, or probably is not compatible with the typical demographic data. If a disease is not predictable in terms of etiology, it should be suspected that there is an occupational history, there is an occupational reason or etiology behind such kind of things. So there are basic three routes for harmful agents. First and foremost thing is through your nostrils. Probably inhalation, many entryways for the agent, and it affects your lungs. So once you inhale, people usually inhale from nose. Some people might take it from the mouth, and probably certain agents might goes to the other pores of the body, namely the ears. The eyes. Next would be your three exposure routes for your harmful agent is oral, through your mouth. Did I say? Yes, every time you touch a chemicals, it might react with the saliva in your mouth and probably come from an adverseful effect. And the last one would be your skin contacts. Another way, whether we know it or not, but I would love to appraise to the audience, we also breathe via our skin. Yes, our skin is as alive as anybody can be. It's a skin contact, maybe a mechanical agent, friction, pressure. Chemical contacts will be allergic reactions, erratic. Physical contacts, hot and cold, sunlight. Biological agents is bacterial, fungi, parasitic in nature. So any of this contact, be it mechanical, chemical, physical, or biological agent, as the case might be. Occupational diseases could manifest in multiple ways. Acute within minutes, within a couple of minutes, within few hours. Chronically over a period of sustainable duration, let's say few days, few years. Did I say 10 days, 10 years? Probably yes. Duration between first contact and manifestation of this disease can take anything from a week to few decades. When I say few decades, yes, you might be working as a radiologist and you might be doing wonderful jobs, take all the precautions, but at the fag end of couple of decades later, after you have quit your job, probably the manifestation might take place. So, occupational disease, the local effects can be seen anywhere and everywhere the harmful agent contacted the body. For example, skin, acrylic, epoxy resin, nickel, coal dusted, benzene. Lungs would be asbestos, silica, cotton dust, cadmium, anything. Tract would be GI is gastrointestinal tract, would be of asbestos, nitrosamine, wailing fumes, lead, and so on and so forth. With brain nervous I believe there is organophosphates, the pesticide, lead, mercury. It affects your memory. It affects your rational decision making. It affects everything as far as cognition abilities are concerned. Your blood, it would be circulation with the carbon monoxide, vinyl chloride, trichloroethylene, benzene, toluene. With your liver, carbon, tetrachloride, vinyl chloride, tetrachloroethylene. Kidney and bladder, it's benzene dyes, beta naphthalene, emission of coke, oven, mercury, you name it as a local effect. Effects seen where harmful agents contact the body. Systematic effects of harmful agents seen in other organs and systems of body as the case might be. So there are A, B, C, D, and E groups that have been given for the legislations or the proportions of the loss of ability to the work or to earn. Category A is when it has been caused by an exposure to due to a chemical. Approximately 25 groups of chemical, including carbon monoxide, cadmium, chromium, mercury, lead, benzene. Occupational B would be group B would be the skin orders in terms of skin cancer, skin disease other than cancers. C would be pneumoconiosis or other occupational respiratory diseases, as in pulmonary diseases caused by exposures to 6 different types of dust, including silica dust. Group D is occupational infectious disease. 4 groups of infectious and parasitic disease, including TB or tuberculosis and viral hepatitis. Group E is disease caused by physical agents, radiation, pressure, noise, heat, vibration, ergonomics, as the case might be. In totality, it would be 119 diseases. I am just giving you a brief list to it. Duration of exposures, I have said for pneumoconiosis, it's approximately 3 years. For occupational hearing loss, it might extend from 2 years for a noisy job, 30 days for a noise levels beyond 85 decibel. So look at the exposures and look at an example as the manifestation of disease is concerned. Now, duration of responsibility for leukemia, let's say benzene exposure for 10 years, or let's say chronic arsenic intoxication for even 1 year. And there are arsenic pilferages in your potable water at times. So this is what needs to be understood, taken into consideration. Allow me to give you the ILO list of occupational disease. Disease caused by agent, as in chemical agent, physical agent, biological agent. Now, what are the target organs? We are talking about pulmonary diseases, skin diseases, musculoskeletal diseases as such. Then we have the occupational cancers and others. Now, let us understand the National Institute of Occupational Safety and Hazards. What does NIOSH says? Injuries wise, occupational pulmonary disease most frequently notified as on when on basis whenever there is an issue. In fact, warning signs have been pasted. People, employee working in a particular area has been educated time and again. Training have been considered. So, musculoskeletal injuries, occupational cancers other than lung cancer, amputation, fracture, loss of eye, laceration, traumatic deaths, circulatory diseases. We have reproductive disease, neurotoxin disorder, noise induced hearing loss, dermatological problems for most frequently seen, and psychological disorder as the case might be. Yes, let us explain the chemical exposure and what are the occupational diseases that have been caused. Metals like lead, mercury, chromium, cadmium, magnesium, nickel, arsenic, beryllium, aluminum, and other heavy materials are actually detrimental to the health of the workers. Let's say diagnosis of lead intoxication. It leads to anamnesis. That's a symptom occupational. It's a battery factory wherever. And look at it, we are getting into green energy and we are getting everything into battery, including our vehicle, including our automobile, including our laptop, you name it, and we have it. Battery is becoming more and more rampantly used. Clinical findings, the laboratory lead measurement in the blood, probably in the urine, workplace measurements, lead measurements, treatment. If best treatment is stop the exposure, change the job, change the industry, change the segment. Supportive treatment is hospitalization as on when on basis if needed, and specific treatment is chelations. Absolutely, that is too extreme treatment that we go around it. Now, let us talk about gases. Now, what happened with the exposure of gases? It irritates our skin, mucosa. Mucosa is eyes, you know. So, acid and alkali, be it sulfur dioxide, nitrogen dioxide, or ammonia. NS3 would be ammonia, methyl isocyanate, as the case might be. Simple asphyxiant gases without chemical reaction in the body, for example, carbon dioxide or Methane, for example, CH4, carbon dioxide, methane, nitrogen, helium, which when replaces oxygen causes hypoxia. You feel giddy, you feel nauseating. Chemical asphyxiant is the gas disrupting oxygenation of chemical reaction in the body. Let's say carbon monoxide, cyanide, HCN is cyanide, hydrochloric sulfuric acid. So carbon monoxide, hydrocyanide, hydrosulfur interactions and binds with the protein as on when on basis. We talk about carbon monoxide intoxication. If there is no enough oxygen for after fast burning of carbon dioxide, water has to be applied. Absolutely. One of the most toxic gases is colorless, odorless, irritant, not non-noticeable. Initial symptoms are non-specific, headache, nausea, and fatigue, as the case might be. Pathophysiology is affinity to hemoglobin is 200 to 300 times more than the oxygen. Carboxyhemoglobin or carboxy COHB, carboxyhemoglobin is the pathophysiology. Because in this form, hemoglobin absolutely detests from carrying oxygen thereby. So carbon monoxide intoxication is a very risky job. Please avoid it as on when on basis is in the iron and steel manufacturing cases. Workers of coke ovens, foundry workers, traffic police, firemen, workers at underground garages, workers at boiler rooms, and car mechanics is what needs to be done. Now, about the carbon monoxide intoxication, what are the diagnosis and the treatment? First and foremost, diagnosis is anamnesis, is carbon dioxide exposure. First and foremost thing, apply water out there. Clinical finding is non-specific. At times, it is not very confirmed and it's very less percentage. Lips gets darker red in color. Cherry red lips if required. At times, carbon monoxide hemoglobin level measured in an exhaled layer. In exhaled layer, the person who is exhaling. Treatment is here. Absolutely, yes. Approximately 5.5 hours time, which you got to go around it. Oxygen treatment is 1.5 hours. Hypoxic oxygen treatment is less than 30 minutes. Should be continued until carbon monoxide hemoglobin gets lesser than 10%. It's a general support, or you may get into coma. The patient might get into coma. Aspiration pneumonia comes into it. At times, people hallucinate. Cerebral edema occurs. So protection of carbon monoxide intoxication, how do we go around it? Technical measures, prevention of exposures, enclosed system, alarm, noise, ventilation, personal protector, if possible, mask. In terms of protection, medical measures would be job entry examination, hemoglobin level, smoking, heart rate, chronic obstructive lung diseases, periodical examination, carbon monoxide in exhaled air, carbon monoxide hemoglobin measurement, education about personal protectors as the case might be. Solvent is aliphatic, aromatic, alicyclic, oil distillate, alcohols, glycol, phenol, ketones, esters. Then comes the ethers, glycoethers, glycide esters, acids, amines, chloride, hydrocarbon, chlorofluorocarbons. Others is turpentine and submonoterpenes and dimethyl sulfoxide. Now these are the solvent. These are basic liquids that comes around it. Now if we talk about benzene toxicity, U6C6H6 is benzene. Nothing but the formula of benzene of aromatic hydrochloride carbon prototype. It's a clear, colorless, nice smelling. In fact, the boiling degree is at 80 degrees Celsius. Rapidly and evaporates. Very good solvent. Knucklery is coke oven. Coke oven is used to produce steel. Please. Side product oil refinery. Colonum is glues, painting, sprays, spray painting, thinner, synthesis of organic substances, detergent, chemical productions, and closed system. So, how do we remove the diagnosis of benzene toxicity? First is anemia or occupational history. Lab is benzene is in the exhaled air of phenol in the urine. Sorry. Treatment, possibly no specific treatment. First and foremost thing is to remove that person from that particular exposures. General support, coma, treatment of leukemia. Leukemia is blood cancer. So minded, it is very, very dangerous. Production is technical, enclosed system, ventilation and mask. As long as possible, keep the leakages from spreading, having a enclosed system. Medical is job entry examination, blood count, blood smears from the anemia, periodical examinations, benzene in the exhaled air, phenol in the urine. Now, let us talk about pesticide exposure. This kind of exposure happens to the agricultural laborer more often than not. Are the chemicals used to order to kill unwanted, unwarranted animal or insect or fungi? Four groups. Basically, insecticides like fly, mosquito, malathion, parathion, halogenated HC or DDT, hexachlorobenzene. Fungicide is fungi, herbicide is plant, grass, 2,4-dichlorobenzene, phenoxylic acid, 2,4-D, or rodenticide is mouse, rat, anticoagulant, dicomarol cases as the case might be. Risky job for pesticide exposure is production. You look at the picture, it's an agriculture worker that has been put into it, and they are applying pesticide. In the process, they are also inhaling the pesticide. So, production, storage, transportation. Application wise is preparation, mixing, and spraying. Everywhere there is a risk of an exposure. Pesticide exposure are 1500 different formulations. Mostly 70% are organic phosphorus compound or organophosphates. Toxicity inhibits cholinergic enzymes, parasymptomatic activity, increase in body secretion, mycosis, abdominal pain, blood vision, muscle cramp, diarrhea, nauseating, vomiting, mental status change, confusion, coma, death. Asymptomatic until CHE activity decreases to less than 50%. Less than 10% is the symptoms of the severe intoxication as the case might be. Now, talking about the treatment and protection of pesticide exposures, let us understand with the supportive treatment, enzyme activity returns to the normal level of 1.5% daily. Atropine chemical antagonists or parasymptomatic should be given. Remember, CHE reactivator is the must thing. Protection of the skin during the application, direction of the wind during the application, mask, and so on and so forth. Periodical measurement of the CHE activity should be noticed as often as possible. Occupational disease, I have shown you certain photographs for you to understand what exactly happened with the skin disease. Now, if you look into it, there are reasons for skin cancers and other skin diseases that comes around it. Look what is happening to the hand, it is getting bulged. Look how the skin is deteriorating altogether. These are dead skills already gone around it. The blisters coming around it, nodal basal cell. So occupational skin disease is nearly 30% of the occupational times, occupational diseases. Approximately 90% contact dermatitis, 80% of which is irritating contact dermatitis. Duration of responsibility around 5 years for skin cancer, 2 months for other skin diseases. Agents are physical, biological, chemical. Physical is hot, cold, sunlight, friction, radiation, pressure, etc. That's because of physical that you might be applying around it. Biological is bacteria, fungi, virus, rickettsia, etc. etc. Chemical is chromium, nickel, gases, solvent, glue, gloves, shoe, etc. Deformations are mostly seen in hands because you are working with your hands, and your hands are the first skin exposures for such material. Occupational skin diseases are risky jobs. Let's say the hairdressers, the machine operator, the cooks, the bakers, the galvanizers, construction worker, metal workers, health provider, tire and plastic production units, production workers, leather and rubber producers, workers exposing dyes and paintings work as on when on basis. So let us understand the occupational skin disease for frequent symptoms. This is most important. Burning sensation, pruritus, rash, ulcer, pulous, lesion, nodules, skin color change, crack caused by itching. You look what is happening as on when on basis. These are your occupational diseases that comes around it. Let's say musculoskeletal system disease caused by repetitive physical movement that can harm tendons, absolutely nerves, muscles, and other issues. Now, don't think that we are talking only for the from the point of view of factory production workers, employees. It can happen to a regular people also. Possibly for most of the musculoskeletal system, it happens with all the athletes, people in the sports arena, dividing into two groups of upper extremity, neck, shoulder, elbow, You have heard of this term called tennis elbow, probably wrist, hand, lower back. Most of it, you might have heard of stress fractures in the lower back. That's to the happening to these sports persons. Physical, psychosocial factors are responsible. Main symptoms is pain. Occupational musculoskeletal system diseases, the responsible factors is inappropriate postures, probably movement also. Loads on muscle during works, people who are working weightlifting, powerlifting, people who are putting stress, physical stress I'm talking about, and it happens during sports, and obviously it happens in the factory or the shop floors. Rate, duration, numbers of repeat. Movement required extreme muscle forces, vibration, heat, devices with ergonomical insufficiency, psychosocial problem as on when on basis. Now, what happens with musculoskeletal system in the lower back? We're talking about carrying by hands, bending the body, whole body vibration as on when on basis. Extreme physical load, constant work position, and work position doesn't change. It is more or less similar work position that you're working around it, or repeated movement that comes around it. When I say work position being constant, person might be standing or person might be sitting. In either way, you cannot stand 12 hours a day or cannot sit 12 hours a day in a particular fashion because it eventually is detrimental to your body. The blood circulation comes to a stoppage. Similarly, repeated movement, moving vigorously and probably extending the straining your body beyond a point actually doesn't do no good at all. So occupational cancers, approximately 4 to 5% of all cancers are GI tract, which is gastrointestinal tract. 15% are lungs, chimney sweepers, scrotal scrotal cancers, cancer related to the scrotal skin. We have been talking about Percival Pot, MD 1775, risky jobs of mining, radium, uranium, chemical production, tire production, or in the asbestos industry, people working in the asbestos industry. Now, cancers, occupational wise, what happened, where it happens? It is in bladder for die and tire, brain, bone, colorectal, esophagus, liver, kidney, larynx, leukemia, lungs, again caused by asbestos, environmental tobacco smoke, melanoma, mesothelioma, asbestos, nasal sinuses, nasosirens, pancreas, skin, and stomach, as the case might be. We have been talking about number of occupational cancers as far as which is carcinogenic to humans, absolutely been slotted at group 1. Group 2A would be probably carcinogenic to humans, probably. Group 2B would be possibly carcinogenic to humans. All are susceptible cases. Group 3 is not classified as carcinogenic to the humans, and Group 4 probably not carcinogenic to human at all. So these are the things that needs to be taken into consideration every now and then that comes around it. So talking about occupational cancer, diagnosis, treatment, specific method of different cancer types, protection, occupational diseases thereby, technical measures, operational measures, you name it and we have it. Now, what are the diagnoses for them? It's the clinical evaluation and the lab evaluation. Remember, you need to have a confirmation from both the ends so that this is a dreaded disease. People should take precautions in the first place and the workplace measurements. So, 1 plus 2 is clinical diagnosis, clinical and lab. And third one would be an occupational etiology, the causes thereby. So clinical evaluation is anamnesis, symptoms is occupation, physical examination is finding, physiological evaluation, audiogram, pulmonary function test, EMG, endoscopic examination, bronchoscopy. This has been referred by, I have taken it from this particular thing, which has been being done in Turkey, Ankara. Similarly, again, the same thing in the same publication that I read through, and probably I've been collated the material for you to understand for as far as the lab evaluation goes. The radiology is all about X-ray, ultrasound, CT scan. Biochemistry is etiological, agent, blood, urine measurement. We have been seeing around it the benzene in the exhaled air, metabolite, phenol in the urine, biochemical disorder, hemoglobin, cholestasis, pathology, biopsy, skin, lungs, and come what may. So, occupational diseases, what are the diagnoses thereby? Let us come closure. First and foremost thing, cessation of the exposure. Close. remove yourself and change the contract so that there is absolutely no exposure to the such material. Specific treatment if present, symptomatic treatment if not, and general supportive treatment as on when on required. In fact, everybody should be of everything. So cessation of the exposure is the first step. Specific treatment if present, symptomatic treatment if you find even an inkling of a symptoms being shown around to you, and general supportive treatment. So what would be the take home message for this video? This will be uh, been presented to you in this particular slide. First and foremost thing, occupational diseases are specific to occupation, usually specific to the occupation. Occupation diseases are preventable. I repeat, preventable and should be prevented. So please don't worry around it. Occupational diseases are diagnosed in the presence of a suspicion and investigation. So if you find any reasons behind it, please get it investigated. If an occupational disease is suspected, detailed occupational history should be taken into consideration before you come with a medication procedures. Blood, urine, workplace measurements are performed for diagnosis of occupational disease. Technical, operational, and medical measurements should be applied or probably prevented as on when on basis. With this message, I would love to wind up this particular presentation. Thank you for watching this video.